Welcome to the deep dive. Today, we're going behind the scenes of respiratory care,
Yeah.
exploring the research that shapes everything we know. And,
Have a fascinating journey.
yeah, a lot of folks
Yeah.
out there might assume that research is just for scientists and labs, but it's so much more than that.
Oh, for sure.
It impacts every single patient who walks through
into
those hospital doors.
Absolutely.
So we're really excited to kind of dig into this today.
Yeah. I think of it like we're going beyond the textbooks and the procedures and asking, how do we actually know this stuff works?
Right.
It's a journey into the world of evidence-based medicine.
Exactly.
And, even for folks that are familiar with research, I think sometimes we take
Yeah.
we take for granted, like, well, how did we get here?
Yeah. Right. Yeah.
Why are we doing things this
Yeah.
way? And it really is built on this mountain of research.
Mm-hmm.
And so that's what we're going to unpack today.
Absolutely. And imagine a world where treatments were based on guesswork
Oh,
or tradition.
that wouldn't be very reassuring, would it?
Not at all.
Research really gives us that solid foundation
Yeah.
to make the best decisions for patient care.
Mm-hmm. And it's not just about healing either, right?
Right.
Our source, a presentation on fundamentals of respiratory care research, talks about this concept of the three basic missions of academic medicine.
Right. And it's heal, teach, and discover.
Yeah.
They're all intertwined.
Mm.
We heal by applying knowledge that we've discovered through research, and then we teach the next generation to do the same. It's just this constant cycle of learning and improvement.
That makes so much sense.
Mm-hmm.
The presentation also mentions this acronym RACE for the key players in the research world.
Yes, it stands for researchers, administrators, clinicians, and educators.
Mm-hmm.
And each group brings its own perspective and needs to the table.
Right.
But there's one skill that they all share: the ability to critically evaluate research.
And that's something we can all learn to do, right?
Absolutely.
You don't have to be scientists to understand the basics of research and how to assess the evidence.
Exactly. Think of it like being a savvy shopper, but for medical knowledge. You're not just accepting claims at face value.
Yeah.
You're looking at the evidence. You're asking questions.
Right.
You're making informed decisions.
Yeah, I love that analogy.
Hmm.
But let's be honest, the world of research information can feel kind of overwhelming sometimes.
For sure.
It's like this jungle of journals and articles and databases out there.
It can be daunting.
Yeah.
But our source gives us some really helpful tools
Okay.
to navigate this landscape.
I like it.
So let's start with PubMed,
Okay.
a massive bibliographic database that's been around since 1948.
Wow.
Think of it as this vast library
Okay.
with millions of citations from medical journals.
Mm-hmm.
It's this treasure trove of information, but it can be a lot to sift through.
Yeah, so where do you even begin?
Right.
It's like trying to find a needle in a haystack.
That's where tools like SearchMedica come in.
Okay.
It's more like a curated museum focusing specifically on clinically relevant content for medical professionals.
Okay.
So they already done some of the filtering for you
Yeah.
so you can get to that most relevant information faster.
So PubMed is the vast library.
Mhm.
SearchMedica is the curated museum.
I liked it.
What if you want the best of the best? Like the most reliable conclusions on a topic?
Right.
Where do you go?
Then you might turn to a synthesized database, like the Cochrane collaboration.
Okay.
Think of them as a team of expert detectives gathering evidence from multiple studies
Oh, wow.
and giving you the most unbiased conclusions.
That sounds pretty amazing.
Right.
Why wouldn't we always just use those synthesized databases then?
Well, the catch is that they're often subscription-based,
Ah.
which means they can be pretty pricey.
Yeah, the paywall problem
Right.
strikes again.
But don't worry, we got more options. We also have portals like MD Consult.
Okay.
Think of these as online shopping malls for research,
Oh.
offering access to books, journals, patient education resources, all in one place.
That's a lot.
Mm-hmm.
It's fantastic to have all these resources, but it still feels a bit daunting to know where to start.
Yeah, and you can get analysis paralysis.
Yeah,
So our source offers two really practical tips.
I like it.
First, talk to a librarian.
Oh, that's great advice.
They are experts at navigating all these resources and can really help you find exactly what you need.
Yeah, what's the second tip?
Consider using bibliographic software
Okay.
like EndNote, ReefWorks, or Zotero.
Mm-hmm.
They're like personal assistants for your research,
man.
helping you organize sources, generate citations,
Yeah,
and really save a ton of time.
I could definitely use a research assistant.
Right.
So we've talked about why research matters, how to find the information we need.
Right.
What if we actually want to get involved in research ourselves?
That's a great question.
You know, like, that sounds kind of scary, but
Yeah, but it can be really rewarding, too.
yeah.
Our source suggests starting with device evaluation.
Okay.
This could be particularly interesting for those working with new devices on the market.
I'm picturing like brand new ventilators, nebulizer.
Right, all the cool new tech.
Yeah, all that cool new tech. Where do we start?
So it's often quite accessible because vendors are often willing to provide the equipment for these studies.
Okay.
And plus, this type of research usually doesn't require approval from the Institutional Review Board,
That's really nice.
or IRB, which can be a very time-consuming process.
Yeah, so that's great news for anyone who wants to kind of jump in and
Right.
get started. But how do we know if our research idea is even feasible? You know,
Yeah.
there's so many factors to consider.
That's true, and our source actually provides a handy acronym to guide us.
I love an acronym.
It's called MADSAK. It stands for Measurability, Availability of Subjects, Duration and Timing, Significance of the Results, Availability of Equipment and Funds, and Knowledge of Investigators.
I'm loving all these acronyms. All right, let's break it down.
Right.
Measurability means we need to be able to actually measure what we're studying.
Yes.
Makes sense.
And then there's availability of subjects.
Okay.
Do we have enough people to participate in the study? Duration and timing.
Mm-hmm.
How long will the study take, and is that realistic?
Significance of results.
Yes.
We want to make sure that the findings will actually be meaningful and have an impact.
Exactly.
Availability of equipment and funds.
Mhm.
Can we get the resources we need to conduct the study?
Right.
Knowledge of investigators.
Yeah.
Do we have the expertise to design and carry out the research?
Exactly.
MADSAK.
MADSAK.
All right, I'm going to remember that.
There you go.
Okay, let's say we've got a great research idea.
Mm.
We checked all those boxes with that acronym. We're ready to dive into these research articles, but sometimes those articles can feel a little,
Dense.
a little intimidating.
They can seem dense, but once you understand the structure of a research article,
Okay.
it becomes much easier to digest.
Okay.
Think of it like a blueprint for the research.
Okay, I'm intrigued. Walk me through this research blueprint. What are the key sections?
So every research article follows a pretty similar structure.
Mm-hmm.
You start with the abstract,
Okay.
which is like a movie trailer, giving you a quick overview of the key findings
Okay.
and why the research matters.
Got it. So it's a good place to start just to see if the article is even relevant to what you're looking for.
Exactly.
What comes next?
Then you have the introduction, which sets the stage.
Yeah.
Yeah. It provides some background information,
Okay.
explains the research question or hypothesis, and tells you why this study is important.
So it's like the backstory.
Exactly, the backstory. After the introduction comes the materials and methods section, which is like the recipe for the research.
Okay.
It describes in detail how the study was conducted, the tools and techniques they used, and who the participants were.
So it's all about transparency.
Right.
Showing exactly how they did the research.
Yeah, okay.
Oh.
Then comes the results section, where the researchers present their findings, often in tables and figures.
Okay.
It's just the data they collected.
So just the raw data, no interpretation yet.
Right.
So like the results are the raw ingredients.
Yes.
Before they're cooked up into a meal. I like that.
Perfect analogy.
What about analysis and conclusions? Where's that?
That comes next in the discussion and conclusion sections.
Okay.
This is where the researchers interpret their findings,
Okay.
connect them back to the research question or hypothesis, and explain what it all means.
So it's where they tie everything together and give us the takeaway message.
Exactly.
Okay.
And lastly, we have the references section, which lists all the sources cited in the article. It's important for transparency and allows other researchers to build upon this work.
Giving credit where credit is due.
Exactly.
Okay, that structure actually makes a lot of sense.
Yeah, it's nice.
It's like having a roadmap to navigate those articles. But before we go on a research reading spree, I want to talk about different types of research because
Okay.
there's a lot out there.
Absolutely. There are many different ways to approach research,
Mm-hmm.
and each has its own strengths and weaknesses.
Okay.
Our source highlights two broad categories:
Okay.
quantitative and qualitative research.
Okay, I've heard those terms before, but remind me what makes them different.
So quantitative research is all about numbers and data that can be measured. Think of it as counting things.
Okay.
For example, how many patients in a hospital are using a certain ventilator setting?
Okay.
That would be a quantitative question.
So it's about collecting objective data.
Yes.
What about qualitative research?
Qualitative research focuses more on qualities and experiences.
Mm.
It's about understanding the why behind the numbers.
Okay.
It explores people's perceptions, their beliefs, and motivations.
So if we wanted to understand why patients prefer a certain type of inhaler, that would be a qualitative question?
Exactly.
Okay.
Quantitative gives us the what, and qualitative helps us understand the why,
Mm-hmm.
and both are really valuable.
To get the full picture.
Exactly, to get a complete picture.
Like having two different lenses to look at the same picture.
Yes.
Each one reveals its own unique insights.
Precisely.
Cool. And within these broad categories, we
Right.
have even more specific types of research,
Right.
such as descriptive and analytic research.
Yes.
Ooh, tell me more. I'm ready to go deeper.
Okay, so descriptive research is about observing patterns and recording events.
Okay.
It's like taking a snapshot of a situation.
Okay.
So, for example, describing the typical lung function of people with a specific lung disease.
So it's about painting a picture of what's happening.
Exactly.
What about analytic research?
Analytic research goes a step further by investigating relationships
Okay.
and testing hypotheses.
Mm-hmm.
So it's about digging deeper
Okay.
to understand why things are happening.
So you're looking for connections,
Yes,
causes.
exactly.
That's fascinating.
So, for example, we might look at whether exposure to air pollution increases the risk of developing asthma.
Right.
That's an analytic question.
Okay. It's amazing how many different ways there are
I know.
to approach research. It's like having a whole toolbox of
Right.
methods to explore the world of respiratory care.
Exactly. And each type of research plays a role in building our understanding of this really complex and ever-evolving field.
And speaking of contributing to knowledge,
Mm-hmm.
how do researchers actually share their findings with the world?
So our source outlines 3 common ways
Okay.
to present research.
Yeah.
Abstracts, posters, and papers.
Okay.
And think of them as different stages in the research journey.
All right, walk me through those stages.
Okay, so an abstract is a condensed version of a research paper,
Okay.
kind of like a really short summary of the key findings.
Mm.
It's a great way to share research quickly, like at a conference.
Like a sneak peek.
Exactly, sneak peek.
About posters.
Posters allow for a bit more detail
Okay.
and often include visuals like graphs and charts.
Okay.
They're typically presented at conferences where people can walk around, view the posters,
Okay.
and talk to the researchers about their work.
So it's like a science fair for grown-ups.
I like it, a science fair for grown-ups.
Right.
Yes.
I like that.
And then we have papers,
Okay.
which are full-length articles that are published in scientific journals.
Okay.
They provide the most comprehensive account of the research,
Okay.
including all the details about the methods,
Mm-hmm.
results, and discussion.
So the paper is like the final destination, often
Influence.
for the research findings.
Yes.
And before a paper can be published, it goes through a process called peer review.
Oh, yes, peer review.
The gatekeepers of scientific quality. Tell me more about this peer review process.
So it's basically a quality control check
Mhm.
where other experts in the field evaluate the research
Okay.
before it's published.
Okay.
They look at everything, from the clarity of the writing to the validity of the methods and conclusions.
So it's like having a team of experts critique your work to make sure it meets the highest standards.
Exactly.
Wow. And based on the reviewer's feedback, the editor of the journal decides whether to
Right.
accept the paper, reject it, or ask for revisions.
Mm-hmm.
So even getting rejected can be a valuable learning experience.
Absolutely.
It's all part of the process of refining your research and making it the best it can be.
Absolutely.
Peer review is crucial for maintaining the quality and rigor of scientific knowledge.
It is.
Wow, this deep dive has already been so eye-opening. I feel like I've gained a whole new appreciation for this world of research.
I'm glad.
But we're just getting started.
Right.
So join us for the next part of our deep dive, where we'll go even deeper into the world of research methodology.
Sounds good.
I'm excited about it.
Me too.
So stay tuned.
All right,
We'll be right back.
We'll be back.
Welcome back to our deep dive into the world of research in respiratory care. Last time we talked about why research is so important.
Right.
Those handy tools for navigating all that research information out there.
Yes.
And even how to get started with your own research project.
Right.
It's pretty amazing how much goes into creating the knowledge that shapes patient care.
It is. It really is.
Yeah,
It's a
right.
process.
Yeah. So today we're going to put on our detective hats
Oh, I like that.
and take a closer look at how research is actually designed and conducted. I
Yeah.
love that, image research detectives.
Yeah.
So where do we begin our investigation?
So let's start with a really fundamental concept in research.
Okay.
Variables.
Okay.
And you can think of variables as the ingredients in a recipe. Just like changing the amount of flour or sugar is going to affect how your cake turns out.
Yeah.
Changing the variables in a study can really impact the results.
Okay, that's a helpful analogy.
Okay.
So, in a study looking at the effectiveness of a new breathing exercise for COPD,
Okay.
the breathing exercise itself would be a variable.
Exactly.
Okay.
And the outcome we're measuring, like lung function, would be another variable.
Okay.
We call these independent and dependent variables.
Okay.
The independent variable is what we're manipulating or changing in the study.
Okay.
And the dependent variable is what we're measuring to see if it changes in response.
So the dependent variable depends on the independent variable.
Exactly.
Okay, that makes sense.
Yeah.
But how do we make sure that everyone's on the same page about what these variables actually mean?
Right. Because, lung function can be very broad.
Yeah.
What exactly are we talking about?
Right.
That's where operational definitions come in.
Okay.
They're like the detailed instructions in our recipe, making sure everyone understands exactly what we're measuring and how.
Got it.
So, for example, if we're looking at lung function,
Yeah.
we need to specify what measure we're using,
Okay.
like FEV1, which measures how much air someone can force out in 1 second.
Okay. So it's all about being precise and clear, just like a good recipe.
Right. You got to follow those instructions.
Needs to be.
Yes.
Now let's talk about different research methodologies,
Yeah.
kind of the how of research.
Mm-hmm.
Our source mentions experimental research, where
Yeah.
researchers are actually actively manipulating a variable
Yes.
to see its effect.
Mm-hmm.
You'll often hear about randomized controlled trials or RCTs.
Yes, RCTs.
They're kind of considered the gold standard
Yes, the gold
for
standard,
determining cause and effect.
because it really helps to control for a lot of those other factors that might influence the outcome
Okay.
that we're not interested in.
Mm-hmm.
So
How do they work?
they involve randomly assigning participants to different groups, like a treatment group and a control group.
So in our breathing exercise example,
Yes.
one group would do the exercises and the other wouldn't.
Exactly. And then we can see if there's a real difference.
And that's how we know if it actually works.
Right.
That's how we know if the exercises are what's making the difference.
Exactly. But RCTs aren't the only way to do research.
Okay, what else is there?
We also have observational research,
Okay.
where researchers aren't manipulating anything. They're simply observing and recording data.
So it's more like watching and taking notes?
In essence, yes.
Okay.
And there's a few different types of observational studies.
Okay.
We've got cohort studies, which follow a group of people over time,
Okay.
like a group of smokers
Mm.
and non-smokers,
Mm-hmm.
to see if they develop a particular outcome, like lung cancer.
Oh, okay. So it's like a long-term observation,
Yeah.
seeing how things unfold over time.
Exactly.
What are some of the other types?
Then we have case control studies,
Okay.
which compare people who already have a certain outcome,
Okay.
like a disease,
Okay.
to those who don't.
Okay.
And then they look back in time to see if there are any differences in their past exposures.
Interesting.
Yeah. And then we also have cross-sectional studies,
Okay.
which take a snapshot of a population at one point in time to assess the prevalence of a certain condition or behavior.
Okay.
So lots of different ways to gather information.
So many ways. Yeah, it seems like choosing the right research methodology really depends on the question that you're trying to answer.
Absolutely.
Okay.
Each approach has its own strengths and limitations,
Mm-hmm.
and researchers carefully consider these when they're designing their study.
Makes sense. Okay, so let's say you're reading a research article
Mm-hmm.
and you want to determine if the study is reliable
Okay.
and if the findings are trustworthy.
Right.
What are some things you should look for?
So one important factor is the study design.
Okay.
RCTs are generally considered more robust for determining cause and effect because they help to control for bias. But even within RCTs, there can be variations in quality.
Okay, so how can we tell if an RCT is well designed?
So look for a large sample size.
Okay.
The more participants in a study, the more reliable the results are likely to be.
Makes sense.
Also, pay attention to whether the study was blinded.
Okay.
This means that the participants and/or the researchers didn't know who was receiving which treatment, which helps to eliminate bias.
So it's like a taste test
Yeah.
where you don't know what you're trying.
Exactly. You don't know if you're getting the Coke or the Pepsi.
Exactly. That makes a lot of sense. What else should we consider when we're evaluating research?
So pay attention to the dropout rate.
Okay.
If a lot of people dropped out of the study, it could skew the results.
That makes sense.
And don't be afraid to look at the statistical analysis.
Okay.
You don't have to be a statistician
Right.
to get the gist of it.
Statistics can definitely be a little intimidating.
Yeah.
Lots of numbers and
Yeah.
formulas and things.
The key is to look and see if the researchers used appropriate statistical methods for their study,
Okay.
and if they presented their findings really clearly and transparently.
Right.
If that statistics section is just like, whoa, I'm lost,
Yeah.
or it raises red flags, that's something to be aware of.
Okay, that's good to know. It sounds like critically evaluating research is a skill that takes practice
Oh, it does.
and a little bit of detective work.
Yeah, it's a process.
Right. But the more you do it,
But the more you do it,
the more confident you become in assessing the research
Yeah.
and making those informed decisions based on the evidence.
exactly.
This has been so helpful. I'm feeling much more equipped now to navigate
I'm glad.
the world of research articles.
That's great.
And I'm actually kind of excited to see what we explore in the final part of our deep dive.
I am too. It's going to be good.
Welcome back to the deep dive. We've been exploring this world of research in respiratory care, learning how to find reliable information, and even how to evaluate those complex research articles. It's been quite a journey
It has been a lot.
so far.
Yeah.
But there's one more essential piece of the puzzle we need to talk about.
Yeah.
The future of research in respiratory care.
Ooh, the future.
Yeah. What are some of the big questions that researchers are tackling right now?
Well, there's so many exciting areas of exploration.
Mm-hmm.
One area that's really evolving is personalized medicine.
Okay.
Imagine tailoring treatments to an individual's unique genetic makeup or their specific needs
Mm-hmm.
and lifestyle.
That sounds kind of like something straight out of a sci-fi movie.
It might have seemed futuristic a few years ago,
Yeah.
but with these advances in genomics and data analysis,
Mm-hmm.
it's becoming more and more of a reality.
Really?
Yeah, we're starting to see personalized approaches in areas like asthma and COPD,
Okay.
where treatments can be fine-tuned based on a patient's individual characteristics.
That's incredible. It makes so much sense. Why should everyone with the same condition receive the exact same treatment if their bodies and their needs are all different?
Exactly.
Correct.
It's not a one-size-fits-all approach.
Right. Okay. So what else? What's another exciting area?
Another area of growth is telemedicine and remote monitoring.
Okay.
Imagine using technology to track patients' lung function,
Oh.
symptoms,
Mm-hmm.
medication adherence from the comfort of their own homes.
So instead of having to make those frequent trips to the clinic,
Right.
patients could have more control over their own care
Right.
and stay connected with their healthcare providers remotely.
Exactly.
That's really neat.
Yeah, and this could be especially valuable for people living in rural areas or those with limited mobility.
Mm-hmm.
It has the potential to improve access to care
Yeah.
and potentially even catch problems early on.
Before they become more serious.
Exactly.
Yeah, it seems like technology is really playing a bigger and bigger role in both respiratory care research and practice.
It really is.
Yeah.
And artificial intelligence, or AI.
Oh, yeah. AI is everywhere these days.
It is. It's everywhere.
What's it doing for us in respiratory care?
Yeah, so AI algorithms are being used to analyze large data sets
Okay.
and identify patterns that might not be visible to the human eye.
It's like having an extra set of eyes,
Right.
but these eyes can see things that we can't even imagine.
Exactly.
Yeah.
So, for example, imagine an AI system
Okay.
that can analyze chest x-rays or lung sounds
Okay.
to help diagnose conditions earlier and more accurately.
Yeah.
Or an AI-powered tool that can predict which patients are at highest risk of complication,
Oh, wow.
allowing for more proactive and targeted interventions.
That's amazing.
Yeah. It's like having this virtual assistant who's an expert in respiratory care,
Mm.
always working behind the scenes
Yeah.
to support clinicians
Yeah.
and improve patient outcomes.
That's incredible. That's a great way to put it.
And this is just the beginning. AI is rapidly evolving,
Yeah.
and its potential in healthcare is just enormous.
This is all so fascinating. It's inspiring to think about how research is continually pushing the boundaries of what's possible in respiratory care.
It is.
It makes me really hopeful for the future of the field.
Yeah, it's a really dynamic and rewarding field to be a part of.
Mm-hmm.
And the more we understand about research, the more empowered we are as both healthcare professionals and as patients.
This deep dive has been an incredible learning experience for me, and I hope it's been the same for you.
Me too. I've enjoyed it.
We've learned about the why, the how, and the what's next in the world of respiratory care research.
It's been fun.
It has been a pleasure exploring these topics with you.
Likewise.
And remember, this deep dive is just the beginning. Keep asking questions, keep learning, and keep diving deeper into this fascinating world of research.
Absolutely.
Who knows, maybe you'll even become a research detective yourself.
Maybe.
Thanks for joining us, and until next time, keep exploring.
See you later.